Hello and welcome to Getting Your Money's Worth, the show that focuses on value. I'm Judith West, and our guest today is Peter Pitts, former Associate Commissioner of the FDA Commissioner in Washington, and now founder of Center for Medicine in the Public Interest. Did I get it right?
That's right.
I have it. Okay. Thanks for being on the show, Peter.
Oh, my pleasure.
Center for Medicine in the Public Interest. Interesting that you have that lofty title. Is it all of medicine in the public interest?
Well, my mother-in-law thinks so.
Yeah. But, well, I'd like to think so.
But what we do, we're a not-for-profit think tank, a public policy institute, right. And we focus on bringing medicines to market both more quickly and more safely, and helping the government understand that they need the tools for 21st century regulation so that we can have the medicines that we need in the 21st century.
Yeah. So why do you have to add public interest? Isn't that sort of a built-in hypothesis in a medicine?
Well, not necessarily. I think right now when we're all talking about healthcare reform, there are really two paths we can go down. Either the path of healthcare reform for the public, which empowers patients and doctors, or healthcare reform that puts Uncle Sam into the role of Uncle Sam MD, which I think is not in the public interest. So I think it's important to remember that when it comes to medicine and public health,
so that's a good distinction.
It's the public.
So that's a good distinction. So you want to make it very clear that you're an advocate of the patient.
Absolutely, and the physician.
And the physician. Okay. Now you talk in your book, which I suppose I should hold up, Coincidence or Crisis, Prescription Medicine Counterfeiting. We'll get to that later. You talk about an organization called the Federal Coordinating Council for Comparative Effectiveness Research. What on earth is that?
It's a lot of words, huh?
It's a lot of words. I got to put it on paper.
In the stimulus package, it just passed Congress.
Yes.
There was $1.1 billion that was kind of hidden in there for a government body that will basically determine, which medicines are most effective for which diseases, which is kind of a bad way because they're using very old-fashioned tools, and ultimately it becomes a way to tell doctors how to practice medicine.
Let's just go slow. So there's $1 billion. I mean, we say billion so easily these days. Billion, million, trillion, it all gets smushed up, right, with the zeros. But 1.1 billion is a decent size of money, different size amount of money.
It sure is.
And this Federal Coordinating Council is kind of like a sleuth. They're going to investigate how money is being spent?
Well, it's not really a sleuth so much as it is a slush fund for certain types of research.
Yeah. And who's going to be conducting the research?
Well, that's a good question. Well, the government's going to pick and choose its favorite academics to do research to, in many respects, prove what it wants to be true.
It's the research for how to cure disease?
Well, that's the scary part. Not at all. It's really to take various types of medical technologies
that are already on the market.
Already on the market, drugs, surgeries, other types of interventions, and based on kind of old-fashioned science, comparing apples to oranges, develop rules to tell doctors how to practice medicine.
Okay. Is the goal of this organization, of this research group, is the goal to contain costs?
Well, that's a good question, because I think the answer is yes.
So is there anything wrong with containing costs, Peter?
Well, I think
certainly they're rampant.
When you contain costs to the detriment of patient care, I think there's a lot wrong with it.
Well, let's talk about that. This show is called Getting Your Money's Worth. Would you be willing to say that there is a correlation between the amount of money we spend on health care and the health of the American public?
Yes, I think it's a negative correlation. I think that we waste a lot of money in this country.
All right, so fine. So when you say it depends on whether the costs are going to be good or bad, obviously,
sure.
It's not as though spending a lot of money. I mean, we already know that Americans already spend more for their health care than citizens of other countries.
That's right.
And we are certainly not tops on the list. We're not even in the top 10.
Well, it depends how you look at the numbers. We're doing pretty well, but I think the situation is that we've got to spend the money more smartly.
Okay.
And we've got to focus the spending on outcomes than on saving money for governments.
All right, so let's go. Spending smartly is a good idea. Now, shouldn't we be able to trust the government to ascertain that, since theoretically they are not supposed to be covering anybody else's backside? They're supposed to be looking for the public interest.
Well, that's a good point.
It's taxpayer money.
Good concept, but that's not the way it plays out, because right now the government is the biggest payer for healthcare services, and the government's iron in the fire is they want to save money. Just like insurance companies want to make money.
Yeah, and there's nothing wrong with that.
Well, something's wrong with it when the government has as a priority saving money as opposed to providing excellent care.
But the 2 points, providing excellent care and preventing cost and achieving cost effectiveness, are not at odds.
They're not at odds if you do it right, but the way the government's going about it is not the right way.
Well, are you suggesting that you know a better way to do it?
Oh, absolutely.
And what is that?
Right now, the government is taking different types of technologies and they're comparing apples to oranges. What they need to do is, rather than focusing on cost effectiveness, focus on clinical effectiveness. Which type of surgical, medicine, healthcare intervention derives the best outcome? Because a patient who is treated earlier the right way is much less costly,
right,
remains active, pays taxes, and that's really where you want to go.
You would assume that part of that was built into their resuch data.
Well, you'd like to think so, right? But that's not the way.
What you're saying is not necessarily, such rarefied thinking.
That's right. I mean, again, it's not rocket science to put public health in front of saving government money, but that's not the way it's playing out.
Okay, all right. So you talk about health reform. You mentioned health reform. The direction that health reform is going, would you say it was something akin to socialized medicine?
It depends. I mean, it certainly could go that way. When Uncle Sam becomes Uncle Sam MD, then you use that expression. Then you're moving down the road towards socialized medicine, as opposed to having the government partner with the private sector to be able to deliver excellent care to more people.
How can we achieve this partnership? We elect representatives in Congress. We expect them to speak in our interests. If they're not, who is?
Well, I think at the end of the day, what you want to look at are some models that do work. For example, Medicare Part D, which is the drug benefit for senior citizens in Medicare, is a partnership between government and private industry.
And I have heard nothing but how much it costs.
Well, actually, 95% of people who have it are very happy with it. It's coming in way under budget and providing excellent care.
And so anything that works ought to be a model for going forward.
I think absolutely that's right, because when you look at places such as Europe and Canada, where the government really is the only player, you see care denied, you see lower and worse health outcomes. And in fact, Europe and Canada are now looking to the U.S. to understand how our model of collaboration works best. So I think when you talk about healthcare reform, when you think about larger collaborations, that's a good thing. When you talk about a larger role for government, it becomes somewhat problematic.
Let's get down to just some basic. I can't say, Peter, that I talk to anybody that isn't frustrated with this country's health care. Whether people have insurance or they don't have insurance, they have Medicare, they have private. I don't know anybody that says much about, gee, they may say I'm getting good medical care, but the system is working. Most folks seem to have very negative points of view about the way that. How did it come to be that we are such a jam here?
Well, I think that,
as far as delivery.
Well, first of all, I think that the only time people generally have a negative feeling about the health care system in this country is when they are sick. So rule number one is don't get sick.
Well, I wish that we could vote for that.
We did a poll in New York, and we asked people if they would prefer government care or universal care. And they almost all said universal care. Nobody wanted government care. And then when we asked them what the difference was, they didn't know.
I would say, what's the difference?
And then when we asked them how much they'd be willing to pay for it, they said, "What do you mean pay for it? The politicians say that it's free. It's free care. But of course, in Europe and Canada, you pay upwards of 20 to 30% premium on your income taxes for taxes, and all of a sudden, people weren't so keen on the concept."
Of course, people pay off for Medicare also.
That's right.
Out of their payroll. Yeah. I don't think that there are too many of us that think that anything the government runs is going to be run very well.
I think that's right. And coming from the government, I can attest to that.
Yeah, I think that's general. So here we are. We have a system that isn't working very well for lots of people, and that for sure is true. Mm-hmm. And we have a system that most folks don't want, which is a government-run system. So what are we to do?
Well, if you think health care in this country is in a bad state, and I think it is, you need to look elsewhere to realize that it's not quite so bad as other places.
I know, but that's not how. That's like the old joke. How's your mother-in-law compared to what? Right. We don't want to compare ourselves to worse.
What we need to do to really improve healthcare is understand who needs the improvement first. And you hear numbers like 48 million people without insurance.
Yeah.
And it's important to understand who those people are.
Okay. So what about who are they?
So the numbers start with this 48 million.
Okay.
So 10 million of those people are illegal aliens. And we haven't really had a robust debate in this country about whether or not we want taxpayers to pay for that.
Okay, and we're not going to have it at the moment either. So we know that. So we know that what 20% or so are
right. You have 16.1 million who right now, as we're talking, already qualify for government benefits but haven't signed up.
So you mean to tell me that there are 16 million, like a third of their
16.1 million.
16.1 million that could get it, and they're just negligent about signing up?
That's right, and the government has no programs in place to make them aware of these programs.
So that's a lack of education.
That's right. Then you've got another between 10 and 15 million Americans under the age of 30 who earn in excess of $50,000 who are not married, who don't buy insurance, although they can have access to it.
And that's their personal choice.
That's right, because as you know, when you're that young,
how
you're
is it
vulnerable.
that you know these numbers and nobody else ever talks about them?
Well,
I don't see them in the papers. I don't see them. I don't see those numbers bandied about.
Well, I'll have to send you a bunch of my editorials.
Please, what?
But that's exactly the point, is that all of a sudden, so you're left with like 15 million working poor. They make too much to qualify for government benefits. They make too little to really afford insurance. That's the hardcore number, and that's a soluble number, 15 million people. You can address that.
But that's solvable, right? Exactly.
But again, it gets all buried in the political rhetoric of the situation.
And what about all this insurance mess? I mean, you have insurance, you don't have insurance, you can go to the doctor, you can't go to the doctor.
And it is a mess.
And it's a mess. And in a few words, we're not going to solve it now, but
we can solve it now if we work really hard.
Yeah, we don't have enough time. But what is your sense of how this can be turned around?
Right now, insurance is regulated on the state level, 50 different insurance commissioners. There's no economy of scale. It needs to be regulated on the federal level, aggressively, robustly, so that insurance companies can sell insurance policies across the nation. It's going to lower costs. It would make it much more accessible to many more millions of Americans. It would be a very good start. And again, it's a partnership between the federal government and private insurance companies.
So we'd have some kind of a blanket uniform payout.
Basically, because if I'm buying...
But isn't it costs more? I mean, I see all the time. It costs more to go to a doctor in New York than it does to go to a doctor in Fort Lauderdale, Florida.
That's right. But the important thing is access to insurance. Because right now, I have 2 kids and a wife, so I have a family of 4. The policy I buy from my family, for the exact same family in another part of the country, it could be 2/3 less.
Yeah.
Because there's no economy of scale.
So it's not because the medical costs are different someplace, but there's no... You say economy of scale. How does that relate to insurance?
Well, if you can buy a policy across the nation, there's a much larger pool of people that can defray the cost of people who are ill. So you also provide care to people who have pre-existing conditions.
But that would be true. Really, you could use that example for auto insurance or anything else.
That's exactly right.
Yeah, but now we're talking about health. All right. So and that would be a piece of government control that might work.
I think the second thing actually the first thing government should do, the low-hanging fruit.
We don't have much time.
Is to get the 16.1 million people who qualify for government benefits signed up.
Right. That certainly makes sense. Okay, so that's the first thing, and there's certainly... Have you written to your congresswoman?
I've written to my congresswoman, my senators. I've written in the New York Times and on television and radio. I have my fair share of people to talk about.
Let's see if anybody responds. The second thing that government can do in about a minute.
Be honest about the number of Americans who are uninsured, because people look at it, they see a big number.
So this is kind of the same idea. Break it apart.
Right. And again, the most important thing is don't talk about politics, talk about public health.
Quickly, what do you mean? What's the difference?
Politics is good guys and bad guys. Oh. Public health is solving the problem.
Oh. Well, I think that's a very good point, a very good way on which to end, because I do think that so much time is spent in this country philosophizing about the problem. If we use all that energy towards solving it, we would probably have solved it already.
Hey, it's not going to be easy, but it's a good start.
Right. Okay. Thank you very much for being on the show. You condensed, which was a very weighty topic, health reform. Peter Pitts, I'm Judith West. You're watching Getting Your Money's Worth. Thanks for watching.